So first of all, thank you for your time. And I want to hear it in your own words here. Why the lawsuit?
Well, I think most Wisconsinites assumed that there was a specific period of time in which an emergency declaration would last issued by the governor. And I think many legislators kind of also assumed that. We thought it would last for 60 days. And then it was up for the legislature to revisit that to see if we wanted to work with the governor to extend that. But Governor Evers completely abandoned that whole theory and simply worked under a separate set of statutes that said the Secretary of Health could pretty much do whatever she wants to do for as long as she wants to do it at his direction. So we're asking the Supreme Court to kind of weigh in on both of those issues, whether or not the 60-day emergency declaration should be adhered to and whether or not that's constitutional. And then, like I said, the second piece is, listen, we've got a process, a very formal process that we've used for hundreds of years here in Wisconsin, which is called rulemaking, which is a back and forth discussion between the executive branch and the legislative branch when you're making law. And they have completely circumvented that. And that should be alarming to everybody in Wisconsin. And we're asking the Supreme Court to weigh in on that.
Well, the lawsuit says that DHS Secretary Designee Andrea Palm is using czar-like powers. What does that mean, considering she's obviously doing what the governor also wants?
Yeah, they're unchecked. And you know, even the governor has admitted at this point that he's abandoned the emergency declaration in the last 60 days and is working under the idea that, you know, she has the full authority and power to push this as long as she wants. And I think when it went way beyond May 11th, that's really what got our attention. And many of the members of my caucus, and I know that Speaker Voss, when we spoke, we said, wait a minute, you know, there is a separation of powers issue that has clearly emerged. And that is, how long can the executive branch just continue to issue these rules, which have the power of law without ever checking with the branch of government that is most closely related to the public, and that's the legislative branch. You know, it seemed obvious to us that we have no choice but to get this cleared up, and we're very hopeful that the Supreme Court will take it up and do just that.
Does public health not override this?
No, you know, that's why originally both sets of statutes were created, because we understand that sometimes when there's an emergency, such as a pandemic, that there should be a nimbleness that's given to the executive branch to be able to make very quick decisions when it comes to public health. But at some point, it's, you know, you exceed your authority by never negotiating with the legislature. And, you know, the administration is saying, well, we've tried to talk to the legislator. We have been meeting with them. No. We're not talking about just informal conference calls. We're talking about a process that's been in place. So whether it's the Department of Transportation or the DNR, I mean, we have a process in place that's been there for many years. It's called rulemaking. And it absolutely has to be adhered to, or there is no balance between the two branches of government.
What specifics of the governor's safer-at-home order extension do you have a problem with?
Well, I think the ones that are obvious to people are the ones that just don't make any sense. You know, just this weekend, it looks like the tee times are going to be fully booked on every golf course in the state. Lines outside of Home Depots, Walmarts, any of those retail components that are considered essential. But when you talk about a restaurant, you know, no, lock it down and close it up. Many of the religious services that have caused so much concern for people. I mean, I'm not saying this is just Wisconsin. There's no rhyme or reason to some of these shelter-in-place orders across the nation, but it's caused a level of frustration, I think, at this point that, you know, if the legislature was involved, I think we maybe could negotiate something that makes a lot more sense. And as a result of that, I think it would have more support. I think if people felt like they had a voice in this, that, you know, we could come to an understanding of how long this should go on. And then, you know, the regional question as well is whether or not up north, which has seen very few cases and deaths related to that, should be opened up. We're very concerned about the revenue streams. And the reason we are is because, you know, in the fall, schools are going to need more money. And a lot of the DHS programs, the safety nets that are created to help families, they're not going to exist either if we don't have any revenue there. And then the big concern about hospitals, specifically rural hospitals, that have been completely closed down, not doing any elective surgeries. If that doesn't change soon, or if there isn't more federal money that comes our way very quickly, some of these small hospitals could close down, and that's not something anybody could support.
But up north, some have been saying don't come up here because we're not able to support if people get sick and maybe bringing coronavirus from Milwaukee.
Yeah, I know there's a concern of the transfer, and I know it's anecdotal, but you hear about Illinois license plates being in Door County and all over the state. I mean, it's another thing that I think undermines people's confidence that the shelter-in-place order that the governor came up with is really not being effective right now. So, yeah, I understand. I mean, I think people they're raising a lot of questions because the order is so confusing.
How do you want to reopen? What's your plan?
Right now, the two major business groups, MMAC as well as WMC, have been working on plans. I have a couple of senators that have been part of that process. Senator Chris Kapenga, I think, is doing a good job in trying to explore different avenues that the legislature could take, offering ideas. Nothing in concrete yet, but certainly working on trying to come up with a plan that we think makes sense for retail and restaurants to reopen in a very safe manner. And a lot of these are going to meet the guidelines that have been set by President Trump. So it's not just the Wisconsin legislature working on its own. I think there should be a back and forth with the administration to make sure we come up with a plan that makes sense instead of just continually extending the shutdown with very little explanation about what the data is that supports that, or certainly I think the governor not being able to explain consecutive days on and what the trend lines are that he's asking for. He's been asked that recently by a reporter, and he could barely even explain what the data showed or what his expectations are. That's alarming. He should have a better handle on this.
Have you consulted medical professionals at all in terms of reopening the state?
Yeah, Wisconsin hospitals, certainly Medical College of Wisconsin. There's many others, Children's Hospital, all have been part of the negotiations to make sure that there's a back and forth dialogue on any plan that ultimately the two major business organizations will roll out, or that the legislature ultimately will come up with, to make sure that there's full support from the medical community on anything that we do.
So you're saying you have support from the medical community to open up the state now?
Yeah, I mean, that's obviously what the goal is to make sure that there's buy-in there, and that, they're very concerned. If you talk to Wisconsin Hospitals Association, they're very concerned about rural hospitals just drying up right now. There's promises of federal money. The latest package that just came through looks like there's going to be some federal dollars, but it still hasn't hit yet. And as a result of that, with all of these elective surgeries being shut down, they want things opened up as well. They understand that their communities are hurting, and that if the revenue streams aren't there, that they're already we're in a difficult position even before the whole coronavirus issue came before us in some of these smaller hospitals, and this just made it much worse.
But the president's or the governor's order reflects the president's. It has the same guidelines pretty much, with that 14-day downward trajectory and more testing. So do you disagree with what the president is saying as well?
Well, that's not true. I don't believe it's accurate at all. I mean, what Governor Evers did last weekend was pull together some people at the Capitol and said, dream up something that'll be closely related to the president's plan, so that we can beat back kind of some of the criticism that emerged right after he extended the order. If you look at the president's guidelines, they're pretty broad. And I think if you view the president's press conference that he's holding every day, he's made it pretty clear that it's still the governor's decisions, but they believe that there's some broader guidelines that should be adhered to.
But he said the 14-day, the president said the 14-day and the more testing.
Yeah, and so far, the governor can't even explain what Wisconsin's data is related to the 14 days. Some people believe that we've already met that, and others are saying, what's the formula, Governor Evers? And he's been unable to explain that. So it's caused a lot of confusion.
I'm wondering, two members of your caucus are calling to fire DHS Secretary Designee Andrea Palm. Do you want that?
What I think we should do is bring in the secretary and maybe ask her some of the questions that many members of my caucus have been wondering about as of late. I hope there's an opportunity for us to maybe have her come before the Health Committee and answer some of those questions. A couple members have put together a letter that's been addressed directly to the secretary that we're still waiting to get some answers on. Hopefully that'll happen soon. Because I think there is some concern about how the secretary is managing the situation right now.
Would you bring senators into session to potentially fire her?
I think there's a point in time where we will have a discussion about all the cabinet members again. We have been methodically kind of going through those members, confirming them every time we've hit the floor. But there's a reason that the secretary hasn't been confirmed. And obviously, with no one could foresee all the circumstances that this secretary has to make decisions on, or as an appointee of Governor Evers. I'm not sure how closely they're working together on this, but I think there will be more questions that'll have to be asked of the secretary moving forward.
Will you be showing up at any of these protests over the governor's orders?
No, I understand the level of frustration that small business owners are going through as we hear from them in the districts that we represent. There's estimates now that 35% of Wisconsin businesses will never reopen. That's shocking and certainly disappointing. And every day that we go forward without having this open up a little bit, it's just another small business that's probably going to go by the wayside, which means more unemployment. The numbers are alarming. Department of Workforce Development cannot keep up. They're falling behind every day.
But do you support big groups of people going out there right now and doing this?
Many of the legislators are very concerned about the unemployment claims that just aren't being addressed right now by DWD as well.
I mean, do you think that's safe for people to be going out and protesting the order?
Well, they're going to try and do it. My understanding is in a number of different ways. I don't know what the strategies are, but they're trying to do some social distancing. I'm not sure how that'll work, but I don't know much more about them beyond that.
And everything seems to be a fight. I mean, when we talk about the lawsuits trying to limit the governor's powers when he took over, the election, and now this, what do you say to people at home who are frustrated, who say this is just partisan politics during a pandemic?
It's pretty clear. The governor had 60 days to make these decisions, and he decided to exceed that. I think many legislators thought this would go to May 11th, and then we would have a sit down and figure out how the state would move forward from there. But he said, no, we're going to go beyond that, and I'm going to use my Secretary of Health to exceed those 60 days. He's completely abandoned the emergency declaration, and it's one of the reasons we're in court. So, I think there is pushback. We need better information, more explanations. They have no tracing program going on that we can speak of. There's a lot of things that are going on in other states that, quite honestly, are led by Democrat governors as well, and they're just further ahead from where Wisconsin is. We seem to be waiting for the governor to take a leadership role, and it just hasn't happened so far.
We haven't seen you here on Upfront since the election, so I wanted to be sure to ask you about this. We know that at least 19 people who either voted in person or worked at a polling site on Election Day tested positive for coronavirus, and state health officials are saying you can't for sure blame the election, and I understand that, but I am wondering if you have any pause, any regret with going forward with that.
Well, yesterday, Mayor Barrett admitted that there is no trace program in the city of Milwaukee. He admitted it. He said they're trying to establish something. They're trying to develop a strategy on tracing. They think that's very important before the economy could open. So any of these numbers that have been thrown around, whether it's 9 or 19 or anything that they could dream up, it's not going to be verified. It hasn't been verified. and they don't have a tracing program. So, I don't put much stock in what they're saying right now. Listen, we've got another election in 2 weeks in about a third of the state for the 7th Congressional up north. The clerks up there that did a wonderful job, by the way, in managing the April 7th election are in favor of this moving forward. And then we have elections in August, and then we have elections in November. I mean, you can't keep postponing elections. And quite honestly, I think besides the huge mishap that happened in Milwaukee when they went from 180 to 5 voting poll locations is a disaster that certainly could have been avoided. The National Guard was ready to go. It was just mismanaged by Milwaukee, but I think the rest of the state has grown accustomed to that happening on a regular basis. But, until they get a tracing program in place, it's pretty hard for me to believe anything that has been used to link the two right now.
Senator Fitzgerald, thank you.
Thank you. Very good to be with you. Thank you very much.